Welcome to CUNY TV's roundtable virtual discussion, Food Insecurity, New York City's ongoing crisis. I'm Tinabeth Piña. It seems unimaginable, but we've been living with the COVID-19 pandemic for over 8 months now. And although many fear catching the virus, more people are fearful of going hungry. At the height of the pandemic, an estimated 2 million New Yorkers were food insecure, and more than 1.5 million New Yorkers are estimated to experience food insecurity by the end of this year, including almost 500,000 children. Diet quality for many individuals has decreased. The local food workforce has lost more than 2/3 of its workers, and more than 1,000 New York City restaurant and food retail outlets have closed, some never to reopen again. And that's what happened at the local level. According to a study by Feeding America, the national food insecurity rate is projected to rise 4.1% this year and affect over 15% of the U.S. population. That's 50.4 million people across the USA. To help us understand the effects of food insecurity, especially in the middle of this pandemic, are Nick Freudenberg, a distinguished professor of public health at the Graduate School of Public Health and Health Policy; Pam Koch, the executive director of the Laurie M. Tisch Center for Food Education and Policy at Columbia University; and Charles Platkin, the executive director of Hunter College's New York City Food Policy Center. Welcome, everybody. Thanks for joining us today.
Thanks.
Now, all of you were involved in a study called NY Food 2020, which looked at the public health and economic implications of the pandemic in regards to the New York City food system, which have been tremendous, to say the least. Can you tell me why your three organizations decided to do this study together at this time?
Sure. I think we've all been looking at food programs and food policies in New York City for many years. And we were struck right from the start of the pandemic how devastating it was to several different dimensions of the food system here in New York. The food system is all the programs and institutions and stores and workers who are part of getting the food that New Yorkers need to them. And we felt that it was critically important to understand the impact of the pandemic on people's ability to get the food they needed, food workers' ability to be protected. And we thought this called for our three groups, which have been in communication before, but not working together in a single project, to join our forces to really document it. We were very clear that the food problems facing New York City weren't created by the pandemic. There were more than 1 million food insecure people even before the first case of coronavirus infection. And we wanted to make sure, as New York City dealt with this emergency and created emergency programs, that the response would enable us to really build back better a food system, not simply go back to the inadequate status quo before the pandemic.
What was some of the most interesting and positive work done by New York City?
The city almost immediately established a unified and central response, and a food czar, called the food czar, who was Catherine Garcia, was at the helm of this, and she worked really closely with our current director of food policy in the mayor's office of food policy, Kate McKenzie. So this team worked together to lay out a really inclusive, expansive, and much needed plan that was called Feeding New York. And this included residents and had access to free grab and go breakfast and lunches from schools all across the city. They could get groceries from pantries, and there were prepared meals that were delivered to seniors and those that were medically vulnerable through a brand new launch during the pandemic program called Get Food NYC. And this helped to ensure that homebound seniors and medically vulnerable New Yorkers had access to food, and overall provided over 120 million meals. New York City Department of Education's Office of Food Nutrition Services, when schools were closed very suddenly in March, was the first agency to radically overhaul everything that they did so that both children and adults could get meals. And they were giving out meals, and there were no IDs required, no questions asked, and they had communication in over 11 languages. By June, they were operating 500 sites and were serving 550,000 meals a day.
I can mention one more program that I think is a really promising start. It's a program called Pandemic EBT, Electric Benefits Transfer. It was actually approved by Congress. It shows that sometimes Republicans and Democrats can agree on something that helps New York City. And it provided a card, a voucher that enabled every child enrolled in New York City public schools to bring this card to a grocery store or bodega or food store that accepted SNAP and to get $420 worth of food. And that really enabled families to go to the grocery store nearest their house and to get food. And it was one of the first versions of SNAP, the food stamp program, that wasn't restricted to people based on their income, that wasn't restricted based on documentation status. It was based on the principle that every child in New York City deserves food. And I'm hoping as we go forward that we can embrace that commitment that every New York City child, every New York City person deserves to have the food that they need to stay healthy. And if we can keep that spirit in Pandemic EBT, we will make great progress in reducing food insecurity.
Yeah, it was $880 million that went to New York State. So that was like an extra supplement from the federal government to New York State. PEBT has been approved by Congress, again, Congress working together, it expired September 30th, and it's been approved for another year. So through September 30th, 2021.
So in what ways has the pandemic contributed to pre-existing health inequities in New York City? And how does food play such a fundamental role in those disparities?
So food workers, the food sector, both food services and food retail, restaurants, stores, is one of the largest workforces in New York City. It's, third or fourth in terms of the numbers of employment. And it is also one of the sectors easiest for people to enter. There are not a lot of prior requirements or educational requirements to get a food job. But the pay, the working conditions, and the benefits are generally lousy. And it's a low-wage sector, and it includes a high proportion of Black, Latinx, immigrant, and female workers. And the fact that they don't make adequate wages mean that they have high rates of food insecurity, housing instability, and so on. And as the pandemic led to closures of businesses, it threw many food workers out of work. That's an example of a food system in New York City and the nation that makes food affordable by underpaying food workers and by raising the minimum wage, by providing paid sick leave, by requiring health insurance. We can solve those problems and have a food workforce that we treat with the respect that essential workers deserve, the respect and the dignity.
Black and Latinx populations are also at higher risk of chronic diseases like type 2 diabetes and obesity that are risk factors for COVID-19. So it exacerbated inequities that already existed and hopefully will elevate that we need to be making sure that all people in every community can eat well and have high diet quality to prevent both chronic diseases as well as infectious diseases like COVID-19.
Looking at those marginalized communities and the individuals and community members that live there, it's really important to note that many of those community members have high levels of diabetes, cardiovascular disease. So and most of them are from, like Pam said, from structural racism. So you could see why those communities were harder hit.
The richest city in the world, in the richest country in the world, having 1 million people before the pandemic who didn't have enough food. 60% of adults in New York City and 25 or 30% of children are overweight or obese. We've known about that problem for several decades, and we haven't taken the action that will help people to afford healthy diets, find healthy food as easy as the unhealthy food that is relentlessly promoted, particularly in the Black and Latinx and poor communities.
Hold on to any more thoughts. We'll be right back. Welcome back to CUNY TV's roundtable discussion, Food Insecurity, New York City's ongoing crisis. I'm Tinabeth Piña. We'll continue our discussion with Nick, Pam, and Charles in a few, but first, let's take a look at what some local communities have been doing to fight food insecurity.
The fridges provide not only just access to food and eliminating food waste, but it's providing a different education about food and how community and food can work with one another.
Atlantis Gota is an Afro-Latina community organizer who helps stock a refrigerator on 120th Street in Harlem, one of over 50 fridges in the New York City area that stores free food to anyone who needs it.
Accessibility is the name of the game. No questions asked. It's an honor system. You respect the fridge and you respect what's in there, and you can take whatever you need. Every fridge kind of has their guidelines though for what can be put into the fridge and the manner in which it's put into the fridge. For instance, at the 120 fridge, we bag everything. And the bagging is for the accessibility of people taking things out, the health and hygiene of people accessing the fridge, the health and hygiene of the food, and the health and hygiene of the fridge in order to keep it clean and everyone who's accessing the fridge feels like they're being able to get safe food.
Other communities like Washington Heights also have a few fridges set up as well, and it's that idea of community and mutual aid that propels the fridge network forward.
For the Heights, the community has been very great contributors, not only with their time, but also with the food that they're able to give, whether they prepare it themselves, whether they either get it from food banks and just donate that food because they know that they're not going to actually benefit from it and know that there are other people that might not be able to get online when those food banks are giving away those donations, or they might not be able to qualify because they might not even have a home.
I think communities of color have always had that community mentality. I think the roots of a lot of these communities have actually been mutual aid. That's really been how people of color have survived. I think now we're seeing a resurgence of it.
According to the U.S. Department of Agriculture, over 15% of Latino households experienced food insecurity last year, long before the pandemic. And people who live in food deserts like Harlem or Washington Heights are often more likely to experience food insecurity because healthy food is harder to obtain where they live.
In Washington Heights, we do have grocery stores, we have supermarkets, but they are generally not the best quality of produce. And if there are, it usually goes to waste very quickly, and sometimes it can be very expensive. Meanwhile, we do have more locations of fast food places. Those establishments are obviously a clear choice for certain people.
As COVID-19 spread, the Free Fridge Network has become an even more needed resource. Local bodegas, restaurants, and churches have allowed the fridges to be plugged into their outlets. And now with colder weather looming, extra precautions will need to be taken.
All of the fridges will likely be elevated, if they're not already elevated, because of snow and rain, just to protect electrical and to keep it still running. And then depending on the location, they are looking at shelters.
Are you guys getting any pushback from, say, like the Department of Health or anything like that?
I do think it's going to be an inevitability of politics and hygiene getting involved, which is why keeping things as hygienic and healthy now is such a big thing for all of the fridges.
Comida para todos, food for everyone, is the idea behind all of the community fridges. And if you want to volunteer, donate a refrigerator or food, or if you need food, this Google Map shows you the nearest fridge and is continuously updated as more fridges are added to the network.
I'm excited about these new fridges. I just hope everyone's working in the spirit of collectivism and not individualism, because this doesn't work if it's just for the individual. This only works if it's for the people, by the people, and that's how it'll be sustained.
The community fridges in the piece were created because some people can't get to food pantries for a number of reasons during the pandemic. And these fridges are also a form of solidarity and not charity in these trying times. So what are your thoughts about this type of community involvement?
It shows real commitment from a community and trying to sort of take care of itself and understand its own needs and be responsible for those needs. The issues that do come up are that sometimes when you see a community fridge, someone might think, or the city or city staffers or government might think, oh, well, we checked the box, they're handling their own food insecurity, and that's just not the case. There's also food safety concerns, the age of the food, if someone comes to depend on it, is it going to be restocked frequently? So sometimes it's nice when an organization within that community adopts that, that fridge program. But I think it's gotten a lot of news and a lot of media attention because it does show a commitment from the community and people caring and dropping off food. And so I think from that perspective, it's very kind and caring. But one of the things going back to the PEBT is that we've learned and we've known is that government funding is so critical and dwarfs community effort in many instances. So think about that. More than $800 million was given for one program, and most community localized efforts don't have that kind of funding. It would be nice if there was funding for those community programs to that size, but that's not non-existent right now.
The pandemic has brought out wonderful things in the people of New York City and the people of the United States, taking care of each other, recognizing the importance of essential workers and their dignity. And I think in responding to the COVID-19 pandemic, we worry that even New York City, with its wonderful responses, relies too much on charity, because charity isn't sustainable and it won't always be there, just as the community fridges won't always be full. And so we need both things. We need communities caring for each other, and we need to develop the programs and policies and support that will ensure that every person in this city, that every person in this country has healthy food available and affordable, has housing available and affordable. That, to my mind, is what a decent society provides for its citizens.
Again, these kinds of things need a real cohesive effort, and that in our mind. There's a lot of talk around that. There's a 10-year food plan, which we're all going to be participating in. There's a new mayor coming in the next 14 months or so. And I think that it's important to have cohesiveness around this and not bits and pieces, which is what it always appears like to me, that they're bits and pieces, but no cohesive solution.
Now, Governor Cuomo did enact policies for access to healthy food under his No Student Goes Hungry initiative. CUNY falls under that. SNAP was a big part of that. Can you discuss how those initiatives are helping curb food insecurity among students in the New York tri-state area?
Sure. I've been studying food insecurity at CUNY for the last 10 years. And we did a survey of a representative sample of a few thousand CUNY students in April 2020 at the height of the pandemic. And what we found, not to our surprise, but to our consternation, was that rates of food insecurity among CUNY students had doubled. They were already high. They doubled from early 2018 to 2020. And some measures, people saying they worried about running out of food before they could buy more, actually tripled, went from about 16% of CUNY students to almost 50%. The public programs have helped. 18 of CUNY's 25 campuses have food pantries. But with the campuses shut down, those pantries are not so accessible to our students. The governor's program that you mentioned made it easier for certain community college students to enroll in SNAP by counting their workforce training as meeting the work requirements of SNAP. And so that means that as a result of that policy, 45,000 CUNY community college students are newly eligible for SNAP. And our group at the CUNY Urban Food Policy Institute and Healthy CUNY are leading a SNAP enrollment campaign to help CUNY students take advantage of that new initiative. But there is a lot more that could be done. It's still difficult for college students here and elsewhere to enroll in SNAP. And by facilitating those rules, it will make it much easier. In some community college systems in other parts of the country, the same notion of pandemic EBT that was made available to public school students has been made available to community college students. That would be a good move towards really significantly reducing food insecurity among CUNY students. And we'll be looking to the new Biden administration to really take dramatic action to reduce food insecurity at unacceptably high levels before the pandemic and even worse now. And too many students at CUNY and throughout the United States have to choose between dinner and being able to stay enrolled in school, being able to buy a textbook or pay for their Wi-Fi. And as a city, as a civilized city, we shouldn't be forcing our college students to make those choices.
Everyone deserves to have meals, and it should just be a right. It shouldn't be something that people have to worry about and make those hard choices.
One of the things that we talk about is food, healthy food, as a basic human right. And that idea, although it's not codified by law, and it should be, but we're not even talking about that. We're talking about that people have a basic human right to healthy food. And it's something that government needs to be heavily involved with and should be bipartisan. There's no reason in this day and age for people to be going hungry.
And it's a critical question to look at for the city going forward with everything that's going on between the pandemic and food insecurity. That you're right, it is a basic right. That should not even be something that's thought about for a lot of people in New York City.
It's also a good investment, and I'll make the economic argument. CUNY moves more college students into the middle class than all the Ivy League schools, Stanford, University of Chicago combined. And but almost half the students who enroll in CUNY in our 4-year programs and our 2-year programs don't graduate, aren't able to graduate. And part of the reason they can't graduate is because of the financial, health, and social problems they face. And nothing better assures lifetime productivity, lifetime health, civic engagement than having a college degree. And one reason CUNY students and students at other college fail to graduate is because they have to choose between working and going to school. That they have to, that if you're hungry, it's hard to focus on schoolwork. If you're worried about feeding your kids, it's hard to focus on schoolwork. So by creating a food security system that ensures all CUNY students have enough food to pay full attention to their schoolwork, we would be able to bring much more value as an institution to New York, to our students, their families, their communities, and New York City as a whole. So it's a cost-effective intervention, and some food advocates have proposed in the next period, we look at a program like the school food program. Nationally, we've committed to providing school children with the breakfasts and the lunches they need to do well in school. We should be thinking about extending that to community colleges and public 4-year schools. so that is something we hope will get on the Washington agenda in the next administration.
Any other final thoughts?
I think this is we don't know what's going to happen with the pandemic, but the economic recovery is going to take a very long time for New York City. So as we've said before, we just need to keep food security at the forefront of everybody's thinking.
Yes, and I ditto that. And I think that one of the things that worries me the most is that as COVID recedes and there is a vaccine, all good thinking and good thoughts around that, there will still be, as it's been shown in 2008, food insecurity and poverty and unemployment issues will still be going on as everybody's rejoicing about the COVID disappearing. These problems will last for years unless they're paid attention to now.
Yeah. Well, all right, thank you. That's all the time we have for today. Thanks to all of you for taking the time to join us. And if you're watching and have been experiencing food insecurity, the Food Policy Center at Hunter College has a list of food resources for each New York City neighborhood on their website. I'm Tinabeth Piña. Thank you for watching.